As we age, our joints, especially our hands, cause us to lose flexibility and dexterity, due in part to arthritis and pain. Dr. Jeffrey Seip, an orthopedic surgeon at the High Desert Medical Center in Joshua Tree, explains the treatment options.
People become healthier and more active, and it's someone who demands a little bit more, and they're not happy with the function that they have. But the traditional would be probably a 60-year-old patient that maybe had rheumatoid arthritis and has already had a fusion procedure on the opposite side, and that fusion gives them strength and it gets rid of pain, but it lacks motion, and it makes it difficult to look after themselves, do buttons, and just have some of the dexterity and things. So that would be the traditional, and the mostly accepted would be on the opposite side of an already fused wrist in a rheumatoid patient generally. Think of arthritis as having a number of sources. One would be the rheumatologic, so the rheumatoid arthritic, and then there's post-traumatic, and then just good old-fashioned wear and tear arthritis. So it's the end result is the arthritic joint, which is the lack of cartilage between the bones inside the wrist. But there's lots of different avenues to get to that same spot. Lots of wrist replacement, just as many people have heard of knee replacements and hip replacements. It's a resurfacing of the wrist, and we do that for people that have arthritic joint, but also painful arthritic joint. So it's to sort of maintain their function and get rid of their pain. It's an incision that's based off the back of the hand, goes across the wrist into the end of the forearm bone, and it exposes the underlying wrist and the end of the forearm. And then when you expose the wrist joint itself, you resurface both the wrist bones, but also the end of the forearm, which would be here. So you resurface the end of the forearm, and you resurface the carpus, which are the little bones inside the wrist, to give an articulating surface. The procedure's done, it's an inpatient facility, and I worked exclusively at High Desert Medical Center in Joshua Tree. It's a short inpatient stay, but I think it's important anytime you're putting an artificial implant in to make sure that there's a comfortable wound, that there's no signs of drainage, which would increase your risk of infection. The rehab protocol is a minimum of 6 weeks, and that just comes down to just the way that we're made, and it takes 6 to 8 weeks just to make that connective tissue, that collagen that makes the implant stable and stiff. You want to trust it, you don't want it to feel loose. So it's a couple months, of sort of dedicated attention to it, that you notice that it's there, and then for any, our joint replacement or implant, I say it takes 6 months to a year for it to settle down and for it to feel like it's yours. The reason that the surgery should be done first and foremost is to relieve pain. And then after that, the added bonus is that of motion. And that's why I keep referring back to the patient that would end up with a fusion, because that's a reproducible and probably easier procedure to do in many people's hands, but it doesn't give the function the same. So I think the biggest surprise for most people is how the wrist doesn't hurt any longer. These are patients that have spent 30 years in pain, and they very quickly, you don't realize what you can't do. It creeps up on you, and then you have this enlightenment where you can, I can do my buttons now, or I can write better, or look after themselves a little bit more independently. So I think that's probably the first thing, is probably pain relief.